Hey guys, it's the Doc, and here's our next installment of the hashtag Ask Dr. Mudgil series of posts. And this one comes in from YouTube, comes in hot, fresh, off the presses. And it's from Broken4663. The question is, good morning, Doc. Your next podcast, can you explain how they form? Thank you. Well, she's actually referring to a short that we posted on YouTube where I drain a ganglion cyst. So the question is, how do ganglion cysts form? And that's a really, really good question. The answer is, no one really knows how they form, but most folks believe that there's basically like two essential scenarios where they form. So first, a ganglion cyst is a collection of synovial fluid. That's a fluid that's in your joint. And it kind of leaks out of the joint and forms like a little bubble right next to a joint. So they're frequently seen on the wrists, you see on like the knuckles, by the knees, elbows, that sort of stuff. Most folks believe that they're actually a consequence of like just wear and tear, using that joint a lot, flexing that joint a lot. The joint fluid kind of leaks out, forms a little channel, and just collects just under the skin. The other theory is that there's some arthritis in that joint, which facilitates that joint fluid leaking out and seeping out and forming a little pseudocyst. So typically the way we treat these, and I'm not an orthopedic surgeon, but generally, what bothers the patient is that collection of fluid. So when they're moving, they have like a little bit of a restricted range of motion. So typically we just kind of drain the fluid out and get that area to be flat. And for most patients, that gives them either transient relief where they have like a few months or a few years of relief before the cyst comes back. And for some folks, the cyst just never comes back. So that's what a ganglion cyst is, and that's how they form, and that's how we treat them. Hope that answers your question. Let's get it.